Oh, thank you for the great introduction, Emma. We are so excited and grateful that all of you have joined us tonight because we share the same goal and we have the same interest, and that is what's best for our dog. How can we keep our dogs healthy? What can we do? And what is this shockwave that we have been hearing about? What's the story? So we're hoping tonight with Dr. Marzin and myself to share some information for you. We know a lot of you that have joined us this evening participate with your dogs in many different sporting events and doing many different activities with your performance dogs. So we're happy you're here. We know we appreciate your time. My goal is to bust some of the myths that many of you may have heard about shockwave. What is shockwave? Well, I want to begin by being very clear. There's no shock involved, so let's be clear about that. This is a sound wave. Dr. Marzin is going to go into all of the detail and the scientific evidence and show you all of the ways that it is working for your dogs in just a few minutes. I'm going to tell you the parts that I think you want to know that are simple to know. That's why I can tell them to you. This is a non-invasive regenerative option, typically only needed 1 to 3 treatments in a 12-month period is very typical, taking just a couple of minutes per treatment. It's different than a lot of other therapeutic options on the market. Some things that make it different, and again, Dr. Marzin will get a little deeper into this, but some of the things that make it different that we're very proud of is the science. We have plenty of it, more than anyone that we're aware of, published studies showing it is safe and it is effective. I think Dr. Marzin will talk a bit more later about some of the universities that have provided us with some great research. Tufts University, Colorado State, the University of Tennessee, and many, many more. When you're talking about evidence and science, we feel it's not the same as marketing. Saying one vet said this worked, we don't think is the same as several universities writing several papers showing it's effective. So when you're looking at how you're going to choose a treatment for your dog, we want you to be educated. We want you to say, well, I could choose this or this or this or this when you're picking, but we want you to do that with some more knowledge, and that's our reason for being here. PulseVet is provided only by licensed veterinarians. Many of those other therapies that you are familiar with maybe things that non-licensed veterinarians are providing, things you're buying over the counter, they're different. So this is medical grade shockwave. You may have heard shockwave and think shockwave is shockwave, like air is air. But that is not the case at all. Shockwaves are very, very different with different ways of creating a sound wave, different mechanisms of action. They're very different. So don't be fooled. I often comparing Rolex watches and I say, oh, here's a fake Rolex and here's a real one. They kind of look the same. They both sparkle. They don't do the same things and they don't cost the same things. So you should never be paying that sort of price or a knockoff, right? So be aware of that, what you're doing. How do you find a veterinarian, or how do you know if your veterinarian offers PulseVet Shockwave? We have something called the Vet Locator or the Vet Finder, and this is a link to that. They've put the QR code up here for you to use. We want you to check that out. Is there a vet in your area that is offering this therapy? Or let your vet know what you learned tonight. We'll be happy to talk with them about what it is. For me and my dogs, I am very interested in finding an option that is not pharmaceutical. That's what this is. A non-invasive choice, taking just a couple of minutes. Another myth that you may have heard heard is it's painful and it hurts. That's not true, and Dr. Kristin will show you some examples of that this evening in some video. The other thing I'm sure you heard is just for horses. That's certainly not true, as Dr. Marzin will share again some of those examples of some of the studies we have on small animal. I think you might also be happy to know that small animal insurance, if you're carrying medical insurance on your dog, each policy is different. So be sure and check that out. But many insurance companies do cover PulseVet Shockwave. So that is something to know. We have proven it to be very safe and very effective, with treatments taking just a couple of minutes, like I said, and typically 3 in a year is very common. We're going to do more of these webinars for you. We'll get better as we go, so please be patient and with us as we get started on our first one tonight for you. In the future, we have some exciting guests that are going to be joining. One of them, many of you know, if you are part of the retriever world, but Dr. Sarah Love, who is specializes in sports medicine and very involved in the retriever world, will be joining in the future. She's going to talk about some specific indications. We are looking forward to inviting probably some of you that are listening tonight. If you happen to participate with your dog and you have had some experience with PulseVet, we'd like to hear your story and share that with others. We are interested in your feedback and what you have to say. You'll have an opportunity to ask some questions, and we're going to encourage you to join our social media. This will help you keep up with what we're doing. So please look for PulseVet Zomedica on Facebook and Instagram and all of the places you typically go. And with that being said, I need to turn it over to Dr. Marzin. One more thing I want to mention before I do that. Always do that to poor Dr. Marzin. I just was teasing her, like, are you ready? Because I'm not really. Okay. So I'm sure many of you are going to have the question of cost. How much does it cost? And that is really between you and your veterinarian, what the cost is per treatment. I do want to say this. If you're currently treating a dog for an injury, this is commonly used for TPLO injuries with TPLO surgeries, and sometimes for those that aren't going to have surgery. It's a very important piece, but you are familiar with those costs. If you are currently managing a dog, maybe a retired dog with arthritis pain, you're very likely administering to that dog 1 or 2 pharmaceuticals, maybe a nutraceutical as well to help you, maybe some other things you're trying to do for the dog. Typically, they need to go in and have some blood drawn to keep an eye on how those pharmaceuticals may be affecting their organs. So when you add up the cost of those things that you're currently doing over a 12-month period, I'm pretty confident that this will line right up with that cost, and sometimes will even cost a little bit less. And we don't worry about any side effects with the PulseVet Shockwave. It's proven very safe. So we'll have to hold those cost questions or hope that helps you a little bit, but that's a personal conversation between you and your veterinarian. So with that, Dr. Marzin, I am going to turn it over to you to be more specific about what this is and how it works for the performance dog and any dog, really. Thank you.
Thanks, Trudy. We're so happy that everybody decided to join us today. We're really excited to talk about Shockwave. I figured we'd start out just with a little bit of history of Shockwave. And really, this has been around for a while, even though it's lesser known on the small animal side. It actually started in human medicine for lithotripsy more than 20 years ago. And when they were using it for lithotripsy, they saw other benefits, that it increased pelvic bone density and things like that. And so it led to expansion into orthopedics. And basically they changed the technology so it was less, focused and less pointed towards breaking up stones, and instead broadened it and allowed it to treat more orthopedic conditions. It is FDA approved for a number of human conditions. So a couple being plantar fasciitis and tennis elbow on the orthopedic side. So some of you may have, received shockwave yourself, or at least heard of it from your doctors. And in 2002 is when they started using it in veterinary practice, and it eventually became standard of care in the equine side, especially for treatment of tendon and ligament injuries, although the use has expanded quite immensely to a number of musculoskeletal conditions and wounds and things like that. But if any of you have horses or are familiar with the horse industry, this is used widely in equine medicine, and is standard of care at this time. And then, in 2009 was when PulseVet as a company was formed to provide this kind of shockwave to the veterinary industry. And in 2022 was when we started really expanding into small animal medicine. It had been used in small animal medicine beforehand, but patients needed to be sedated because it was an uncomfortable treatment at that time. With this new extrode that we have, which isn't really new anymore, it's been around for 3 years now, you do not need to sedate. So that really expands the use of it. And you will see that patients are very comfortable when we treat them with shockwave. And that's due to the new technology of this extrode. So that's a little bit about where shockwave came from. But what actually is a shockwave? I know Trudy mentioned that it is not electric shock, and that is true. But what it actually is a high energy sound pressure wave. And this is produced in a number of different ways. So a couple of which being supersonic aircraft, explosions, ballistics. But the example that I like to give, which is kind of mimics how electrohydraulic shockwave, which is PulseVet shockwave, how that works in particular, is lightning and thunder. And so you have lightning, which is an electrical impulse that's going to change the pressure of the air around it, creating a boom of thunder. And if you think of a very big storm that's close to your house, and you get that big boom of thunder and your walls rattle a little bit, that is the sound energy being deposited into those walls. And so essentially what we're trying to do with shockwave, we have a little electrical impulse in the device that is going to change the pressure of a fluid and then create this sound wave. And then we focus it and direct it towards tissues for the optimal effect. So that's how shockwave is created. And then what is it actually doing in the body? So that energy is being released into the tissues, and it's basically going to reinvigorate and put into overdrive the body's own healing process. So it's using, things that are already inside the body, processes that are natural to the body, but it's putting them in overdrive to help decrease inflammation, speed healing. You're going to get new blood vessels to form, which increases blood supply. You're going to get increased quality of healing of these tissues, especially in those tendons that tend to scar up and not heal that great if you let them do it naturally. With the increased healing energy from the body, you're actually going to get better alignment of those tendons and ligaments. So they're going to heal more correct, and you're going to have less issues in the future with future injury and things like that. It will also increase bone production, so allow for faster bone healing and better quality bone healing. And it can help recruit stem cells to the treated area too. So all great things for getting areas to heal, especially areas that are not easily healed in general. We know these tendons and ligaments don't have a lot of blood flow to them. So it is hard and it takes a lot of time. And if those of you who have had a dog potentially with a tendon or ligament injury, you know that takes a long time to get to heal. So we can really not only speed the healing process for those animals, but increase the quality of healing as well, which is great. Some other cool things about shockwave for small animals, we can treat over 20 different indications, and we'll go over what some of those are. We are the only research-backed shockwave device available. So as Trudy mentioned, a number of different universities have done studies for us. We'll highlight a few of them in a little bit. We see results in just 1 to 3 treatments, which is pretty astounding when you think about other types of modalities that help with pain and these types of conditions. We really, usually you're doing multiple treatments to get some effect from that. And it may even be a short-term effect. With this, we're seeing long-term results, not just an immediate pain relief, but you're seeing months and months of improvement in these animals in just a couple treatments, really. It penetrates pretty deep into the body, so you are going to be able to treat any joint, even in a large dog. And the sound waves will penetrate to that depth and be able to heal that area. And as Trudy mentioned, this is incredibly safe and effective. All the research that's been done with our device, there have been no adverse effects noted, so no harmful side effects, which is great because some of the other things we use for pain and inflammation, like our pharmaceuticals, you do have to worry about those things and you have to do monitoring for those things over time. So this is great because you don't really have to worry about that at all. And as Trudy mentioned, it's covered by canine insurance as well. Check with your provider if you are on insurance, but this can help cover it.
Yeah, Dr. Marzin, I just want to add, sometimes people think that it's just masking pain, and that's not true at all. There's very powerful anti-inflammatory effect. That is what is helping. There is published studies showing that we're not just masking arthritic pain, we're actually slowing the progression, the disease progression. So I wanted to just bring that up.
Yeah, absolutely. That is an important factor as well, because a lot of the things we are using for pain and inflammation are really just that. They're decreasing pain. They're either blocking pain response or they're decreasing inflammation a little bit, but they're not actually healing tissues and they're not actually interfering with the progression of the disease, like in the case of arthritis. So that is an important point. So some of you may have heard of other modalities such as laser and be questioning how this is different, because a lot of the things we're saying about healing tissues could sound very similar between the two. So we thought we would just kind of explain how light energy and sound energy can work differently in the body. And laser therapy does have, regenerative effects in the body as well. But if you think about shining a light, which laser energy is light energy, into a body of water, it is going to dissipate. It's going to get lost as heat as it kind of penetrates through the surface. And remember, our bodies are made up of mostly water. Now, when it comes to sound energy, if you think of how that travels through water, if we have marine mammals, submarines that are able to communicate miles through water with, sound wave technology. So it has good penetration and it's a very efficient way of delivering energy through tissues, which are mostly made up of water. So what that means is with your light energy compared to your sound energy, you're going to get usually deeper penetration with your shockwave therapy because of how the sound transmits. You're going to have less treatments, usually less frequent treatments. They're going to be shorter treatments in general, only a few minutes long versus, sometimes 15, 20, 30-minute treatments with laser. And it really depends on the type of laser that your veterinarian has. There are a lot of lasers are definitely not created equal to each other. So just because your vet says they're using laser does not necessarily mean, they're very different from each other. So just keep in mind, even with your high quality lasers, your very good lasers that actually do have effect, you're going to be end up doing more frequent treatments. You're going to be in there more frequently than you will with shockwave, just because of the efficiency of delivering that energy. And remember that we have, 15 plus years of published research on these musculoskeletal indications on the shockwave side. So when are we using shockwave? And these are just kind of a breakdown of some of the things that you may see in your own animals, some of the common injuries that you might see in performance dogs. And shockwave can treat all these. So for our tendon, ligament, and muscle healing, those shoulder tendinopathies, maybe a supraspinatus or biceps injury, if your dog has ever experienced that, this is really the best treatment for those tendinopathies. A lot of times those take a lot of rest, a lot of exercise and rehab to get over, but with shockwave, you're going to heal them a lot faster, a lot sooner, and the quality of healing is going to be a lot better. Same goes for your iliopsoas injuries. We know those are really common, really uncomfortable for those dogs, and kind of takes them out of commission for a little bit. And so we can get those to heal up, get them a lot more comfortable. And then, cruciate ligament tears, those are extremely common as well. Um, and those can tear, partially, or we can have a full tear. Surgery is, usually the best option for those. But in these cases, especially of the partial cruciate tears, if we can't go to surgery, or that's not what we can do right now, shockwave is going to be your next best bet, because you're going to be, increasing the quality of healing of that actual ligament, instead of just allowing it to scar over and, the arthritic process starts. The sooner we can shockwave those, the better off that knee is going to be in the future. So those are some really great tendon, ligament, muscle indications for shockwave. As for bone healing, if the animal does get surgery, we have a lot of research showing that this is going to help them recover faster. They're going to put more weight on the limb faster, which is going to help them build muscle faster. And they're going to, the bone is actually going to heal a lot faster than, and that's been shown through research, than it would if they did not get shockwave after their surgery. Also, little fractures. I know these happen all the time, especially little toe injuries. It's very common. Those little bones in the toes and the paws don't have as much blood flow as some of the other bigger bones in the body. And so it can be tricky to get those to heal. And we want to, speed things up as much as possible. Nobody likes having them in a bandage or splint for extra time, not even doctors, because it's not, there are complications that can arise. So being able to treat those fractures, get them out of that bandage and cast sooner, is very beneficial for the pet. And then with chronic pain, we see a number of chronic pain conditions in performance dogs: osteoarthritis, back and neck pain. This, as Trudy mentioned earlier, we're not talking temporary fix of this. We're talking months, 6 to 12 months of relief of pain and inflammation from these chronic processes with just a couple treatments with shockwave. So it can really, really be beneficial. It can be part of a multimodal plan where we're doing multiple things. But a lot of times it can allow you to reduce or replace some of the pharmaceuticals that you're using for these conditions. And then the fourth category, which is kind of fun, not really a musculoskeletal category, but this is really great at getting wounds to heal. So I'm going to show you some cool wound pictures. Hopefully nobody is too squeamish. I'll warn you so you can look away just in case. But even those things like lick granulomas that are they're not, life-threatening or anything, but they're irritating and frustrating to get to heal, we can heal those up with shockwave, which is pretty cool.
Yeah, before you go on, Dr. Marzin, I don't want to interrupt again, but that's just what I do.
Oh, go right ahead.
You've mentioned a couple of times, and I think it's important tonight that our listeners understand what you mean when you're talking about quality of healing. So what I wanted to remind everyone of what you're talking about is sometime when we have a tendon injury or one of these ligaments or cruciate tear, and they're left to heal on their own, they're often going to end up with a lot of scar tissue, and they'll kind of look like a mess like this if you have them, do a little bit of ultrasound and take a look at them. You'll see a big mess of scar tissue. And when Dr. Marzin is talking about quality of healing, after a couple of shockwave treatments, what happens, which is very important, is the linear fiber pattern starts to line back up perfectly. And that's that quality of healing. What happens to these tendons when they're not shockwaved or they're left to rest often is they heal with a lot of scar tissue. And unfortunately, I'm sure some of you are well aware, but often that results in further injury, because then they will have another tear with all of that scar tissue. I'm sure you're also aware that often we have to worry about the other leg. If we have one of these injuries and they're offloading on this leg, we often, oh no, that's going to be our next problem area. When you're using regenerative therapy like Shockwave, it's worth considering that good leg as a bit of insurance, perhaps. Would you agree, Dr. Marzin?
Absolutely. Yeah, that can be very beneficial.
Yeah.
So I have a little bit of a case study for you guys here, and hopefully these videos will play, but in case you can't see them, I'm going to narrate a bit and just let you know what's going on. And then if anyone would like to see these videos, we will make sure they're available on our YouTube channel, or you can reach out to us and we'll make sure that you can see them just in case they glitch a little bit on this webinar, but we'll see how it goes. But this is a dog named Alex. He's a 15-year-old cattle dog mix. He had been limping on his right front leg for a year. And he went to a lot of different doctors, had a lot of diagnostics done. And sometimes these sports injuries can really be difficult to diagnose. And in his case, they really struggled to get it finally diagnosed. But when they did, he was diagnosed with a shoulder tendinopathy, and they didn't know, what to do. They had had him on pain medications, a whole bunch of different pain medications. They had tried different things, and nothing was quite getting him back to where he was. So this is a video of him trying to lie down in his bed. You can see, hopefully you can see that he's very uncomfortable lying down. He kind of pauses. He takes a while to kind of lay down on his bed, and that's pretty consistent with pain and inflammation. I know my own personal 14-year-old dog takes a long time to lay down in her bed because she has some arthritic joints. So really, with a lot of musculoskeletal issues, that's one of the first things you'll see. And so this is him walking before he got any treatments. And you can see here when his head goes up and down, that's a big sign that, there's discomfort in that joint. So he was obviously very, very much limping. And this is him, after they had tried a whole bunch of things already, mainly pain medication and rest. So instead, they decided to try Shockwave for him. So they went ahead and did a Shockwave treatment on that shoulder. And then this video here is just a couple days after that first Shockwave treatment. And you can see that he's already, way less bouncy in his movement. And so hopefully you can see this video that he's way less lame on that shoulder already just a couple days after that first treatment. But we do recommend 3 treatments for a tendon injury because we really want to make sure we bring the blood flow to that area and make sure that gets healed up appropriately. So they went ahead and did a second treatment on him a couple weeks later. And they also treated his wrist at the same time because he had some arthritis in his wrist as well. And so this is him walking after the second treatment. And almost no lameness can be appreciated in this video. So this was a few days after that second treatment. And really, he's walking pretty normally. I mean, he's slow, but he's a 15-year-old cattle dog. And this is after the third treatment. They went ahead and treated his shoulder and his wrist again. And this is actually a month plus, I think it's a month after that last treatment. So it's not just a couple days after, not kind of that short term. This is a month after that last treatment. And you can see he's walking with his head held high. He seems very comfortable, and all looks good there. So he went from being very, very lame on that right front limb to walking comfortably throughout the house. So the owners were very, very pleased with his progress with these 3 treatments. Oh, I'm sorry. I promised I would warn you. I am going to show you some wound pictures now. So I just have a couple slides on some wound pictures. So if you're squeamish, it's nothing too terrible, but just that's my disclaimer. But just some visual evidence of how it can work on wounds. This picture on the left is a lick granuloma that had been there for a very, very long time. You can see it's pretty inflamed. The skin's really thickened, and a couple treatments later, that hair is growing back even. And a lot of times, getting the hair to grow back on these is just an impossible task because they've been inflamed for so long. So it's healing up very, very nicely. There's that other picture on the right this is a boxer that had had this wound for over a month. So this is a very old wound. It was not healing appropriately. This is about as good as they could get it to heal until they shockwaved it. And you can see the time difference here. They literally just did the one treatment, and 2 weeks later, we have amazing healing. And I imagine that if you would shockwave this one more time, which I'm sure they did, that you would get that to close up completely. So pretty dramatic short-term wound healing there. I have a couple extra pictures here for you, just demonstrating similar things. So we have another little lick granuloma that was actually even bleeding just from the irritation. And you can see hair growing back. And that was just a single treatment for that one. And then another wound over here. They had tried basically everything to get this wound to heal: laser therapy, hydrotherapy, sugar bandaging, and it really wasn't healing until they did 2 PulseVet treatments. And a month later, we don't even have a wound anymore. We just have a little scar. So it can do amazing things for these wounds in a pretty short period of time. All right, that's the end of the wounds. So if you had to look away, you can go look back. Here is a summary of some of the research we have that I know we've been mentioning. And really what this shows is multiple different universities. We have University of Tennessee, CSU, Colorado State, Tufts University, a number of really well-known doctors as well, doing these studies showing positive effect from PulseVet shockwave specifically. We have a lot of research in, as I mentioned, post-op surgeries for cruciate ligament or ACL tears. We have evidence that it helps with weight bearing for elbow osteoarthritis. It can help with lumbosacral disease, or that back pain, that sacral pain that some dogs get, and with shoulder related disease, as we had demonstrated with the case study as well. So multiple different indications. We have research on this from reputable universities. And again, no adverse effects in any of these studies. As far as what you can expect for a treatment, because you may be wondering, how is this going to actually work? Just a couple of things to point out. No sedation is needed in most cases. It is not uncomfortable. It does make noise, but the animals do not care about the noise, I can promise you. You will think that they do when you hear it, and then they will surprise you every time that they really don't care. It's very rhythmic. They just kind of hear it, they consider it background noise, and they go on with their day. So we've had even noise phobic animals do very, very well with shockwave treatment without any sedation or ear protection or anything like that. You do have to use ultrasound gel. So we do put a lot of ultrasound gel on the area, and that's for the transmission of sound, just like if you were going to do an ultrasound for diagnostic purposes, very similar to that. It comes off, it's water-based, it can wash off. So we want to you'll see I have a video here, hopefully it plays. You can see the doctor just moves we call it a trode, the little handpiece, around and slowly moves it. And this dog, you can see it kind of standing there, moving its head, but doesn't seem uncomfortable. It's fully awake. And really, this is all the treatment entails. So it's kind of like a little massage over that area, and not anything really to worry about. And it takes only a few minutes. 3 to 4 minutes is very typical. Here's another video, just so you can see. This is Butters. He's a 15-year-old Chihuahua. He is not sedated. He just doesn't have any teeth, which is why his tongue's hanging out of his mouth. He actually had a fracture of his bone. So a lot of people wonder, in these painful conditions like fracture, whether they would tolerate this treatment. And this is a very short video, but you can see he's just looking around, not really a care in the world, as they use the shockwave on his little foot there. And he had fractures that were not healing very well at all. And just a couple treatments, you can see radiographically that they healed up very nicely after those. So that's Butters. And then what to expect after this treatment is another common question that we get. And you can expect a couple different things. So this happens in horses 100% of the time, but they get this kind of short-term pain relief. And again, we're going to get a long-term pain relief from this as well, but you can get, they immediately feel really great. We always like to warn people about this, because what we don't want to do is then go, oh, they feel great, let's go run them and do all the crazy things that we used to do, because we still want to keep them exercise restricted, make sure that we're following through with the whole series before, and being assessed by their veterinarian before they can go back to their, regular activity, just because we don't want to overdo it and during that treatment time. So it is important to continue your exercise restriction, and to know that, after this shockwave treatment, you might have a very happy, bouncy dog because they feel so good. Conversely, they can get a little bit of discomfort, similar to like when you get a really a big deep tissue massage, or if you exercise really hard and your muscles are a little bit sore. We can see this for 24, 48 hours or so after the treatment. That's totally normal. You can use some pain med if you feel like they need it, but a lot of times it's very temporary. And what we see is a gradual improvement over about a 2-week period. And so that's really what we're looking for. They should be evaluated after a couple weeks by the veterinarian and then retreated if necessary. And then again, we're talking 1 to 3 treatments depending on what we're treating and how the dog responds. And that's pretty much all I have as far as the clinical information. I'm going to turn it back over to Trudy just to finish up, and we can answer any questions that you guys have. Feel free to put them in the Q&A, and we will answer those.
Yeah, that's great, Dr. Marzin. And we also want to remind you, if you have a friend that didn't get to join tonight, or you want to rewatch, this will be available, and we'll spread the word on how to see it. Also, if you happen to belong to a club, or you have a group of people that you feel would benefit from learning a little more about how PulseVet Shockwave is different from some of the other things, or what it is, we may be happy to come out to your facility. We are a worldwide company, as a matter of fact, so we cover the globe. In fact, maybe you have some exotic place you would like us to come, and I could maybe sign up to be the one to do that. Let us know if you have an interest in someone coming out and doing some education for you, if you have a group that might be interested. I don't know what else I have forgotten, except we'd love to meet your vet if we haven't. If this is something that interests you and you've looked at the vet locator and you notice that your clinic isn't currently offering this, we'd be happy to talk with them about it. I know that typically if I go into the lobby of a veterinary clinic and ask, how many of you are here because your dog's in some sort of pain, a lot of people raise their hand. When I say, if we had an option that didn't involve any pharmaceuticals and only required you to bring your dog to the clinic 3 times, typically in a 12-month period, taking really just a couple of minutes each, would you be interested in learning about that? And because you're here tonight, most people are. What I'm really proud of, I've been with this since 2009, is we have done all of the research, and we can show that to you. We can't burn your skin. There's nothing that's going to harm your dog. It's very, very safe. If our goal is to replace the pharmaceuticals, can we always do that? No, we can't, unfortunately. But we should be able to, almost every case, lessen the amount of pharmaceuticals you need. And in some cases, we can replace them or delay needing them. So it's always worth a look. Dr. Marzin mentioned how much faster we can return you back to your performance at the same level of performance you were enjoying, or the level of competition you were at. It has been a game changer, of course, on the equine side now with those tendon and ligament injuries, and it can be the same for you getting those dogs back without any risk. So we hope that we've helped answer some of those questions and busted some of those myths tonight. It is loud. It's a sound wave. I said, there's no way the dogs are going to go for the noise. I have border collies. She's very sensitive. She hates noise. And they've proven me wrong over and over and over again. The sound energy is very controlled. And as Dr. Marzin mentioned, it's very predictable. And sometimes we'll offer the dogs a little peanut butter lick mat treat. Before they're done licking the peanut butter, the treatment's done because it's very quick. And we'll see you again in 2 weeks. We've treated a lot of other animals besides dogs. We treat cats. Goats have been popular lately. I believe we've treated a guinea pig recently. So it's very safe. Hopefully you know that. Emma, maybe you can let us know if there are any questions Dr. Marzin and I could help answer tonight.